The Patient Protection and Affordable Care Act of 2010 marks the fourth major attempt at universal health coverage in the United States. What were the other three? In 1911, a major fire broke out in the Triangle Shirtwaist Factory, which led to a significant number of deaths, mostly women. The public outcry over the lack of insurance coverage for the severely burned almost led to universal coverage. World War I soon ended any and all talks. In the 1960s, universal health coverage was again in the forefront of talks. The Johnson presidency had determined the United States could no longer afford the level of spending. The American Medical Association strongly opposed universal health care, and a compromise was reached on both sides. As a result of this compromise, the elderly and the indigent were provided coverage, and both Medicare and Medicaid were born. Under the Clinton administration, universal health care was again brought to the table. As before, the AMA was strongly opposed. This time, they received large financial backing from many of the private health insurance companies that had nothing to gain and everything to lose. With deep pockets, the opposition was very successful in launching public service announcements, which ultimately led to the demise of further talks. Finally, healthcare reform was once again brought forth under the Obama administration. When President Obama signed the Patient Protection and Affordable Care Act of 2010, he was overheard speaking to Vice President Biden. This was 100 years in the making. The remainder of this lecture will focus on the Affordable Care Act. Some dates have already passed while others are still being pursued. In 2010, healthcare reform was signed into law. Immediate stipulations barring lifetime coverage limits were enacted. In 2011, insurance companies were required to spend at least 80% of their income on coverage expenditures. Prior to this, there was no determination. An insurance company could theoretically pocket large sums of money and deny a high percentage of claims. 2013, Medicare payroll taxes were increased. In 2014, Americans are required to have health insurance or pay a penalty. Businesses with 50 or more employees are required to provide health insurance or pay a penalty. In 2018, Cadillac plans will be taxed much higher. Cadillac plans are those plans that have low deductibles and low copayments. In essence, there is not much incentive for a patient to avoid accessing services. Individuals with higher deductibles and higher copays are less likely to visit the doctor for sniffles or for unnecessary treatments. In 2009, 36% of Americans were turned away from medical services as a result of insurance companies indicating that they had pre-existing conditions which made them ineligible. Employers with 50 or more employees are expected to increase insurance enrollments by an additional 9 million individuals. 16 million will be added to the Medicaid rolls. Many states are already stretched thin. Budgets for other items have been severely diminished or cut altogether. 32 million Americans that did not have insurance in 2009 now have access. This, however, still leaves 19 million Americans without insurance coverage. The question that needs to be answered is how will the field of healthcare, already experiencing severe staffing shortages, be able to absorb 32 million more individuals? Due to the controversial nature within which the healthcare reform established the mandatory need for health insurance, many states, 39 in total, brought legal challenges or lawsuits against the Affordable Care Act. As a result of a long delay from implementation to action, many states are severely behind the creation of their state health exchanges. In 2012, the Supreme Court agreed to hear the complaints filed by the various states. In June of 2012, the Supreme Court ruled in favor of upholding the law as long as some verbiage within its structure was changed. During the presidential election of 2012, the reform was the center of discussion for both sides, with Democrats supporting the reform and Republicans strongly opposed. With Obama's re-election, the Patient Protection and Affordable Care Act was further implemented. What remains to be seen is what will happen when a Republican becomes president. Perhaps most pressing is the previously mentioned delay with many states in the creation of their state health exchanges. The vast majority of states have been scrambling to catch up with the increase in enrollments. The next issue will be that of employers and the need to find health insurance for their employees. A fear of many is that an increased number of employers will reduce their staffing to be below the required 50. The other concern is the further diluting of the coverage base offered by insurance companies. Unfortunately, not as many people have taken advantage of the Affordable Care Act as was previously thought. Additionally, the sickest sick have enrolled and driven costs upward. Many insurances that offered a state exchange plan find themselves running millions of dollars in the red. Premiums for Affordable Care Act plans will increase significantly in 2017, and the government is not planning to subsidize any more than what it currently offers. The future of the Affordable Care Act is still up in the air as the costs are far greater than originally expected.